Welcome back. You're listening to A Path to Wellness on rhinoanair.com, WSPF-DB.com. And this is Dr. Christopher Jackson, PhD, DOM, Florida. Today I'm going to explore what it means to look for the root cause as opposed to the conventional approach of basically treating the symptoms. And wanted to explore that from somewhat of a technical point of view as far as the approach that I do versus what's done, like if you go to an emergency clinic or a hospital or something like that, walk-in clinic. And so the first thing to explore is, well, what is done conventionally for people when they have an issue. And typically the first thing that's done is some blood work. And what will be run is a CMP and a CBC. These are, or maybe just a basic metabolic panel and a CBC. The CBC usually will include differential and platelets, which means that they'll look at your white blood cells and the different types of white blood cells, as well as your red blood cells and some of the parameters that are involved with your red blood cells. That's the CBC. And then the CMP or the BMP, depending, will include a look at your fasting blood glucose, assuming fasting. Look at things like your kidney function, your creatinine, your blood urea nitrogen levels, which relate to a breakdown from proteins through your liver into urea, and then possibly some other factors like uric acid and so on. And a look basically at how your metabolism is working, how your liver is working, your kidneys are functioning, and how you're regulating blood glucose or sugar levels. Those are typical for those kinds of tests that are done initially. In most cases, it won't go much further, if any, beyond the CMP and the CBC. So CBC stands for complete blood count, by the way. And that is the one that explores the red blood cells, white blood cells, platelet activity, and the breakdown of, well, are you elevated in, say, white blood cells? Could there be something with your immune system going on? Or might you have very large red blood cells, or perhaps even small red blood cells, or a wider range of red blood cells? RDW is looking at the range of the sizes of the cells in your red blood cells. And all of these relate to trying to figure out if there's something specifically wrong with any of these parameters, and then addressing them in the conventional route with a drug to deal with whatever issue there may be involved. And that's usually about where it stops, assuming there's not some kind of deep chronic condition indicated by or acute condition indicated by the results of the blood work. So another common one is TSH, which I talk about a lot. And TSH is a hormone that's a pituitary hormone that stimulates the thyroid. And thyroid stimulation is inferred to reflect on the activity of the thyroid, which quite often is not the case. And this is one of the flaws in the approach that's taken for these kinds of issues. So some tests will be run to get sort of a general idea of how your body's doing. And then from those tests will be derived an approach, a treatment approach, usually that, may be dealt with drugs, in most cases will in the conventional approach. Now, in the approach where I'm really focusing on uncovering the underlying cause and not just treating the symptoms, what I'm doing is exploring a little further and a little deeper into what I'm seeing, maybe on initial CMP and CBC, but usually I'm going to look a little deeper, even right up front, because I'm going to base what I'm testing not just on sort of a general rule of thumb kind of test, but on what they're presenting with. What kinds of issues are being presented to me when a person walks into the office. And so what I'm going to do is dig into what the possible interrelationships are with whatever issues they are dealing with. So, for example, if somebody has hypertension, then I might look at, okay, what about their vitamin D level? Because there are a lot of tests recently in the last few years that have shown that low vitamin D can contribute to elevated blood pressure. What about their B vitamin levels, which can reflect on blood flow, and also neurology? If the B vitamins are low, they may be more reactive, more susceptible to stressors that may be involved in raising blood pressure. Or there may be issues with blood flow itself that relate to the lack of B vitamins. So that's looking at the underlying causes. That's looking at the factors that may be affecting that condition. And that's what I mean by looking at or examining the root cause. So I'm looking into underlying factors. Quite often they're nutritionally based, and this is really functional medicine and orthomolecular medicine relate to this. Getting to the root cause is often going to be getting to find out what deficiencies may exist in the body, or what absences may exist in the body, even what may be very, very deficient. And then those things obviously can affect the body function. They can affect metabolism and so on. Other factors that can be involved, say with hypertension. What if the blood is a little on the thick side? So we could look at things like PT-INR, the prothrombin time, and the normalized ratio for the flow of the blood inside the blood vessels. There may be other factors as well, like adrenal activity, and that sensitivity to stressors may be a root cause for somebody being overly hypertensive or leading to blood pressure being too elevated. Because the stressors of life that we all go through may affect different individuals to different levels. So it's not necessarily that, just the same level of stress is going to affect every individual the same way. It's not that case at all. Everybody has their own sensitivities. And so what I'm trying to do as part of getting to the root cause is figure out, well, what's different about this person versus the average person, not just the average person has this and therefore I'm going to give them this drug or whatever. It's not just addressing each person the same way. It's not one size fits all medicine. It's actually customizing an approach the approach that I take at A Path to Wellness to address that individual's specific issues and needs and things that may affect that individual differently from others around them. So this is part of getting to the root cause too, is looking at the individual and what might be different about that individual, and some factors that may be influencing them that may not be influencing others. And one of the factors that is often missed is work environment. The typical response for hypertension would be, okay, cut the sodium, cut out all the salt. There may be another look at, sometimes, at potassium. Are you getting enough potassium? That's not a very common thing that they look at, but that's another factor as well. Or magnesium. Certainly magnesium can be involved. Magnesium is a natural calcium channel blocker, which means that it helps to reduce the reactivity. See, calcium is an excitatory atom, and calcium in the nervous system is excitatory for the synapses, whereas magnesium is a calming mineral that helps to relax. And by relaxing the nervous response, it also relaxes other areas as well. It relaxes muscles, it relaxes smooth muscle, etc. So the relaxing effect of magnesium, the calming effect. In fact, there's a version of magnesium that comes in a powder form called Calm that helps to calm people's responses and helps them relax and feel better and possibly even sleep better at times. So magnesium can be a very important part to all of this in terms of affecting cardiovascular function and neurological function. So that's just one example. That's hypertension. There's so many underlying factors that can be involved. And thyroid, by the way, I was alluding to thyroid. Thyroid can be one as well. Some studies show that thyroid may be involved in hypertensive responses, or in other words, high blood pressure as well. And if you think about it, it kind of makes some sense, because if your thyroid is low functioning, then you may not be processing the antioxidants and minerals and so on that are involved in a normal metabolism. You may not be repairing as well damage that might be done to your blood vessels internally, and so on. So you can end up with things like veins that are somewhat hardened or not very flexible, that may not respond very well under pressure, etc. So many of these things can be addressed that help direct the attention of the treatment toward the actual root causes of these disorders, as opposed to the conventional approach. The conventional approach is more using hypertension as an example. The conventional approach is more to directing the drug toward a targeted function. So, for example, if a drug is addressing ACE, or angiotensin converting enzymes, the ACE inhibitors address this conversion that goes on, and it's a conversion that leads to the tightening of blood vessels within nephrons, or the filters inside the kidneys. And by tightening down on those blood vessels, the blood pressure goes up. So an ACE inhibitor, angiotensin converting enzyme inhibitor, inhibits the conversion of enzymes, angiotensin 1 and 2, and the conversion to renin, that lead to the tightening down, or tightening up, I suppose, of the vessels within the nephrons, and therefore inside the kidneys, and therefore leading to contraction or squashing of the blood vessels, tightening of the blood vessels, leading to increased blood pressure. Calcium channel blockers, which magnesium is a natural version of, will relax the blood vessels, relax the smooth muscle, relax the body, relax many facets of the body function. And yet there are other approaches like magnesium and even certain herbs that can calm the nerves and calm the adrenal response to help to relax an individual. And from that point of view, there are also vasodilators, naturally occurring vasodilators that can be used that open up the blood vessels, opposing the action of renin and ACE to open those blood vessels back up. That's another route to doing that. So the conventional route is to use beta blockers, to use calcium channel blockers, to use Lasix or reduce fluid volume to make you pee more, to get that fluid volume down, to widen the blood vessels is not a common approach, not in the sense that they're actually directing something that widens your blood vessels. It's more about stopping the kidneys from doing what they do to tighten the blood vessels, therefore allowing them to be more open naturally as a response to that. So these are the kinds of approaches taken conventionally, but in natural medicine, there are alternative approaches that work equally as well generally. And there are more. I mean, you can go to the level of helping to open up the cardio vessels that are involved, like the coronary arteries, etc. There are herbs that actually have been shown in testing in studies to open up the coronary arteries. There are herbs that improve the flow of the blood by helping to open up the blood vessels. There are herbs that help to improve the blood flow by other routes as well, like garlic, you may have heard of, and its results in improving blood flow, thinning the blood, etc. Rather than using, Coumadin or rat poison or aspirin, these kinds of things to thin your blood, there are other more natural ways in your food that can help to thin the blood. So again, the conventional approach is basically treating the symptoms, whereas the natural approach is typically going more toward the root cause and helping to change the situation so that these things naturally improve. And the more studies are done, the more we understand about the root causes of these disorders. And unfortunately, in a lot of cases, the conventional approach doesn't really allow for change very quickly when it comes to being able to deal with root causes. They're still just focused on the symptoms. And it's great when it comes to emergency situations, if done well, if implemented by a good team who are sensitive to the patient, who have patient care as their focus, who understand the biopsychosocial aspects of patient care. In other words, that their environment and the way they're treated can affect the medical outcome. If they understand that and they're approaching things with that in mind, then a better result is usually going to evolve from that care, and people can recover well and so on. But that's in the acute phase, and what can happen is they simply get changed over to more drugs that are toxic to the body, that keep them long-term being exposed to these damaging chemicals, and that's the conventional route. That's typically what is switched over. However, they can start off with acute care and take care of that situation, then transform over to more natural approaches as well. That's another route. And the natural approaches quite often will address the root cause, not just the symptoms. So if we talk about other situations like diabetes, say. So diabetes is becoming epidemic. There are huge numbers of people in our population becoming diabetic. And there are many reasons for this, and I've discussed some of those reasons in past shows. But some of it is about the food that people are eating and the food industry and what they're putting in the food that can lead to this. And to give you an example, artificial sweeteners. Artificial sweeteners tend to be creating more insulin resistance, which means that somebody who's diabetic and is trying to avoid sugar, who chooses an artificial sweetener, may think they're getting less sugar, therefore they're better off, but actually because they increase their insulin resistance, their condition becomes worse. And that's often the case. So having a person pare back on those kinds of substances and simply having them avoid the sugars, the sweets, the starches, especially the grain starches, much improvement can be seen simply with that. So there are other things that can affect blood sugar regulation as well. For example, back to stress. Stress increases the production of various chemicals. The adrenal function is part of that, wrapped into producing things like cortisol and adrenaline and other hormones that are involved. And within the cortisol realm, we have cortisols that are mineral corticoids, and then we have cortisols that are glucocorticoids. And the glucocorticoids, as indicated by their name, have glucose in their molecules, which means that when somebody is stressed, they are producing more of this hormone typically, and therefore may be producing more glucose, converting more glucose, and that results in their bloodstream an increase in sugar levels. So if somebody's under a stressful condition a lot, and it has gone to a certain point, they may cross the threshold where all of a sudden their blood sugar is way out of whack because their regulation of that blood sugar has been progressively becoming worse due to all of the stress. And they can end up with a form of diabetes. So that's a root cause as well. So we have the food as a source, choosing wrongly or in a negative way anyway, choosing foods that are not good choices, just fundamentally, like the grains and starches and sugars and sweets. And then there are hidden choices that they may be making that they may not be aware of, such as the additives and preservatives that are in the foods. And then there are also the artificial sweeteners. So some of the additives that may be in the foods that can add to blood sugar regulation issues also affect thyroid, like bromates and bromides. And that effect on the thyroid can thereby affect blood sugar regulation. So we've got issues with that. What's in our food? And we've been talking a lot about that lately. So blood sugar regulation can be affected by many things, and understanding what somebody is eating and how that may be affecting their blood sugar regulation is an important facet to treatment and to getting somebody on a path to wellness. So unfortunately, typically the conventional approach again is to give somebody a pamphlet or just say, stay away from sugar or something like that. And that pamphlet may say something about healthy grains or, consuming foods that may actually exacerbate the condition, or diet sodas, diet drinks, which actually increase insulin resistance. So we need to look more to root causes and understand what's underneath all of these things and how it may be affecting the condition that a person is experiencing. So when I talk about root cause, you can see that I'm not just talking about the food you choose. I'm not just talking about the environment that you're in. I'm not just talking about stressors that may be involved. I'm not talking about things like elevated cholesterol, which is a symptom, not a cause. It is not a disorder or disease. It is simply your body's response to consumption of certain foods like sugary foods or conditions that may be going on inside of your body where you're not processing proper nutrients from your food, or you're not eating the right food. And many factors can affect this. So when I bring somebody into the office, when I have somebody in the office and I'm exploring these things, I'm asking a lot of questions, and those questions are designed to sort of connect the dots, as Marie would say. Connecting the dots in terms of what might be tied into the condition that they're experiencing. Their choices in foods need to be addressed in most cases because of the effects they can have on physiological conditions and the metabolic workings of the body. Now, many people are not aware of some of the inflammatory conditions that are created by food choices and how those choices can affect their bodies in terms of their recovery or turning around conditions that present that are very inflammatory. And that is a large portion of the chronic disorders that we see. A large portion of them are rooted in inflammation. And to compensate for that, we can use anti-inflammatories, and I'm not talking about NSAIDs. I'm not talking about ibuprofen or Tylenol or Aleve or any of those. I'm talking about herbal anti-inflammatories that aren't so harmful to the body, that are not going to hurt your intestinal tract, your stomach, etc. I'm talking about anti-inflammatories that actually help your body, that not only bring down inflammation, but can reverse some nasty conditions, such as, for example, liver issues. If somebody's having liver function issues, one kind of anti-inflammatory that can be very helpful is curcumin. Curcumin can help to recover your liver and help to improve its function and its structure, basically help to improve how your liver is working, but also how it is substantially in terms of any sort of decay or breakdown that it may be having. Uh, and the same kinds of things can be done with other organs, like, for example, for your kidneys. If your kidneys are having trouble filtering correctly, if you have a low filtration rate due to maybe a history of UTIs or urinary tract infections, or other types of things like being on the Atkins diet, for example, can be damaging to your kidneys, or other types of approaches that you may have taken that are high protein, especially high animal protein. You can end up with inflammatory disorders that affect your kidney function. And your kidney function is very important to balancing your electrolytes in your body. Therefore, if they're not balanced correctly, you may have problems with either acidity or alkalinity, or balancing of the actions of your muscles, things like that. So you may end up with cramping. Your electrolytes might be out of whack. These kinds of things. So again, when I'm investigating somebody who has kidney function issues, I look at a lot of parameters. I look at how they're processing, of course, the proteins. I look at their filtration rate. It's known as the glomerular filtration rate, based on the function of glomerula, or a filtration mechanism, a little mechanical structure that's inside your nephrons, inside the filters that are made up to be your kidneys. Understanding more thoroughly how those kidneys are functioning can be helpful, and whether or not there may be a history of kidney stones, these kinds of things. So addressing those issues can help to recover an individual. Helping to improve the filtration can help to recover those kidneys. And I've had many patients who came in with low filtration rates in their kidneys, who were in some stage, anywhere from 3A to 4B, all these various stages of kidney dysfunction, and even further down, much further down actually, right on the brink of dialysis, and reversed a lot of these people's kidney issues. In fact, let's just say upwards of 90% of them. And it's really about helping your kidneys function better, helping that filtration improve, getting to the root of that. Or if there's an inflammatory condition, helping to bring down that inflammation, and therefore allowing the kidneys to flourish again. And there are ways of dealing with inflammation beyond just curcumin. There are many anti-inflammatories that are available. Everything from fish oil or omega-3s to frankincense and myrrh from the biblical reference, right? Frankincense, myrrh, and I think gold. So frankincense and myrrh are anti-inflammatories that have been used for thousands of years, obviously, because they're in the Bible. So many of these substances can be used that bring down inflammation and help to improve functionality of whatever organ it may be, not just kidneys, that may be inflamed. Now, there are other approaches as well. The approach that I'm talking about right there is more herbal, using herbal substances that help to improve filtration in this kind of. But there are other routes as well. Like if somebody is inflamed, very likely they have an elevated level of interleukin-6. This is an inflammatory cytokine, which is a chemical messenger that stirs up inflammation. Acupuncture can be very helpful for this kind of thing as well. Acupuncture helps to increase macrophage activity, specifically M2 macrophage activity, that then increases the anti-inflammatory levels. In other words, it increases the levels of interleukin 10, which is an anti-inflammatory cytokine. And that can help to oppose the interleukin 6, which is an inflammatory cytokine that's stimulated by another type of macrophage activity. So acupuncture tends to reduce the negative macrophage activity, reduce the inflammatory substances, and increase the anti-inflammatory activity. So it's very good for this kind of thing. Any sort of inflammatory disorder, whether there's pain involved or not. You may not experience pain, but be inflamed anyway. It's not necessarily directly related. People can be inflamed and not know anything about it. And part of how we know that is if somebody's not experiencing pain, yet we test them and we see a CRP that's elevated, maybe in the 3s, 4s, 5s, 10s, or their homocysteine is elevated. So each of these proteins is an indicator of an inflammatory condition in the body. So by looking to the root of the inflammation and addressing inflammation at its core, we can help to reverse these conditions. And by working on repairing the conditions, repairing the organ function, giving certain nutrients or herbal medicines that help to reverse the negatives, we can improve the functionality. So these are things that get more to the root of what's going on, not just treating the symptoms. And you know, it's very gratifying when I take somebody who's been looking at a long-term reduction in their kidney function, for example, or reduction in their liver function, or heart or cardiovascular issues going on, and helping to reverse those conditions, helping to improve their functionality, helping to buy them some years. Or if their weight has been a particular issue, if somebody's extremely overweight or even just a little bit up, wants to lose a few pounds, and they come in with that in mind, quite often we'll look at why are they heavy? What's precipitated this? One of the conventional theories is, that everybody's just overeating. Well, I don't think so. I don't think everybody's overeating. In fact, a lot of people come to me and they're eating very mild or very small amount of calories, very small amount of carbohydrates, etc. And yet they continue to gain weight. And sometimes that relates to way more than what they're eating. It can relate to the thyroid function or adrenal function. Now, there are other ways that people can gain weight as well. They could have some cardiovascular issues. They could be holding a lot of fluid. They could be showing signs of edema. There could be some heart functionality issues that may need to be addressed. And then obviously there are other things that can affect weight as well, like kidney function can cause pooling, edema, things like that. There's a problem with kidney function. So whether that is a physiological condition that is a problem, or it's simply a matter of gaining weight because of eating too much McDonald's or Burger King or too many fries or drinking too many Cokes or these kinds of things, can be determined simply through conversation usually. And by understanding a person's patterns, we can really address the underlying cause and help to reverse those situations. So say somebody has Alzheimer's or dementia. That's also an inflammatory condition. And we have inflammatory amyloids or proteins that lie in their brains that can cause some disruption in communication. And so another aspect of this, of course, is the inflammatory nature of it. It can also be, there can be other root causes to that, and we can get deeper. We can also help to improve like for example, they may be deficient in some B vitamins. Choline is an important one. In fact, the neurotransmitter acetylcholine is made up of an acetyl radical and choline. Choline is a B vitamin. So if you're deficient in that particular B vitamin, you may not be able to produce enough acetylcholine, which means you may not be able to produce the neurotransmitters involved in cognition and even clarity of thought and even memory. And this is where drugs like Aricept come in. They defeat enzymes or inhibit enzymes that eat up the acetylcholine. They're called acetylcholinesterase enzymes. And so we use, in conventional approaches, acetylcholinesterase inhibitors to address those situations and help to improve mental function for people suffering from dementia or Alzheimer's. But again, that may not be getting to the root cause. If somebody has been consuming a lot of sugar, this may be related to that condition. So a lack of certain nutrients or eating too many sweets. And actually those have something in common, because when you eat a lot of sweets, quite often it has an effect on your body where there's some damage being done to your blood vessels. So by way of that damage that's done inside the blood vessels, there can be some things accumulate inside the blood vessels. And the same thing can happen in the brain, the accumulation of sugars. You have agglutinated fats and agglutinated proteins. These sticky proteins stick inside your brain and can clog the works. So diet can be involved in many, many conditions. And it is also something that conventional medicine doesn't do a lot to address. There's some, and some of the facilities will have, pamphlets where a dietitian has written out all of the things that they think you should be consuming on a regular basis. However, quite often those things can be problematic. I've seen a lot of these kinds of forms that laid out particular aspects of somebody's diet that should be, according to them, taken up and added to their diet. This kind of thing that can actually make the problem worse. So understanding fully how those substances, those foods, may affect someone's brain function or lung function or cardiovascular function, etc., is an important aspect of getting to the root cause of somebody's condition and being able to treat that root cause and not just the symptoms. I mentioned lung function there briefly. Lung function. So we can look at things like allergic asthma or allergies, right? Hay fever, etc. One of the aspects of that kind of response is an inflammatory response at times. But another aspect is the histamine response. And histamines can be put to bay, put to rest, essentially. It can be calmed down, the histamine response, through some natural substances as well. Oligomeric proanthocyanidins are among them, or OPC. OPC, which an isotonic version of OPC is available through Nutrimetrics and can be accessed through our website, aptw.net. But OPC helps to reduce the histamine response. It helps to offset that allergic response and can calm that response. And has some other benefits as well in terms of anti-inflammatory benefits, these kinds of things. So to get to the root cause and get to the core of why things are happening, often diet and nutrition are involved, and maybe the key issues because they affect so many things. Vitamin D has so many functions in the body, it's unbelievable. B12 and folate and B6 are very important to cardiovascular flow, to your nervous system, many, many issues. To your adrenal response, your stress response, very important. And as I mentioned earlier, certain B vitamin is very important for your brain function. That's choline and acetylcholine production. So we look to these kinds of issues to understand more thoroughly what's at the root of these physiological issues that come up in one's life. And that was just kind of an overview, but I wanted to kind of explore that a bit and try to clarify the difference between treating the symptoms and treating the root cause, or targeting the underlying factors that affect an individual's physiology and gives them issues with their health. So that's the focus of my practice, Path to Wellness. And I like to make it the focus in a lot of ways of my radio show by the same name of Path to Wellness. And so if any of that interests you, or you think that maybe this approach might be a better way to go, focusing on the root cause and really getting to the core of what the issues are that lead to those physiological conditions, then I encourage you to give us a call at 727-329-9637, or you can hit our website if you'd like and take a look at what we do at www.aptw.net. APTW, of course, is short for A Path to Wellness. So I'm Dr. Christopher Jackson, PhD, DOM, Florida, and you've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. Thanks for listening.